Assalamu alaikum warahmatullah guys. As I have promised to you guys, if the internet restores, we'll be taking classes online. So today we'll be discussing regarding schizophrenia. Schizophrenia is one of the major psychotic conditions. So in order to understand schizophrenia, we need to understand about psychosis. We define psychosis. Psychosis is defined as a severe mental condition which is characterized by disorganization of the personality, deterioration in the social functioning, as well as there is loss of contact with the reality, and there may be also evidence of hallucination as well as the delusions. So if we write disorganization of personality, deterioration in social functioning, and loss of contact with reality, or we can also write distort of the reality. So understanding this disorganization of the personality. What is personality? Personality is sum total of our emotional traits, behavioral traits, or temperamental traits, or mental traits which are specific to a particular individual, which means that whatever personality or whatever emotional traits, behavioral traits, or temperamental traits and a person possesses in a pre-morbid personality. Pre-morbid is before the morbidity, before the disease condition, or before the occurrence of the symptoms. Whatever personality he possesses, there is disorganization of that personality. Secondly, deterioration in the social functioning, that is whatever societal role or whatever occupational role he was performing previously, there is some problems with the role or social functioning as well. And also there is loss of contact with the reality. Reality is measured in terms of insight. So what is insight? Insight is self-awareness. How do we measure it in a client? We measure it by asking him whether he has awareness about having a disease condition and requiring a treatment. How will we ask this? We'll simply ask the patient, why are you here in the hospital? If he answers that I am here because I am ill, so his insight are he is self-aware about his own disease condition or about his own health. If he answers, no, I don't know why I am here, he might also answer that I don't know, there is nothing wrong with me, they simply brought me here. Or he might also say, I am ill, but my illness is attributed to some external factor. These are graded on the insight scales, which ranges from 1 to 6. 1 being the loss of insight, no insight is present, and 6 is true emotional insight. So in between, if we see 2 is due to attributed to some unknown cause, attributed 3 is attributed to some external factor, 4 is due to some unknown causes, or whatever it might be. So highest score, if a person is not having insight, that means the score is 1. If the person has insight, the score will be 6. The true emotional insight, or 5 is intellectual insight. Based on that, we categorize insight. So next we talked about there may be presence of hallucinations as well as delusions. Hallucinations and delusion. What is hallucination? As I have previously defined it to you guys, hallucination is an idiocentric belief which is not shared by others regarding the same situation. For example, if 3 persons are sitting in a room and 3 persons, whatever is in the room, will describe usually the description of the room, whatever is presented, and the 4th person comes and he gives a description of unusual description of the room. For example, there are kites flying in the room, or I can see there is some sort of music I am hearing. So that time we call them as hallucination. So hallucinations are idiocentric belief which is not shared by others regarding in the same situation. Okay, so what are delusions now? Delusion is an false unshakable belief despite the evidence against the belief. So what is that? If, for example, somebody believes in something, and then he also has the evidence against his beliefs. For example, if I believe that I am going to die if I go outside, but there is no factor outside which might kill me. If I still continue to believe this, despite reassurance from the people, no, if you go outside, going outside is not going to kill me. But people are reassuring it to me. But in spite of the reassurance, I still continue to believe, no, going out might kill me. So that time, my thinking will be called as delusional thinking. Okay, so there are different types of delusions which we will talk about later as the schizophrenia unfolds. So as far as psychosis is concerned, so we define once more, we define psychosis as a severe mental condition where there is disorganization of personality, there is deterioration in the social functioning, and there is loss of contact with the reality, as well as there might or may not be the evidence of the hallucination and delusions. Okay, there might be the evidence of hallucinations and delusions. This is regarding psychosis. Coming back to schizophrenia. The term schizophrenia was coined by a Swiss psychiatrist named as Eugen Bleuler. In 1908. So Eugen Bleuler coined the term schizophrenia. If it is a Greek, derived from a Greek word. Schizo means split and phrenia means mind. It is a mesomer, nothing. It is a mesomer, nothing to do with this split mind. So understanding schizophrenia is one of the most crippling psychiatric disorders, or one of the most difficult psychiatric disorders for the psychiatrists to treat, as well as for the patients to overcome, or for the clients to overcome. If we see schizophrenia over the years, we have seen schizophrenia. There is it is so crippling that 50% of the hospital beds in psychiatric hospitals obviously are occupied by schizophrenic patients. 50% of the beds in psychiatric hospitals are occupied by schizophrenic patients. That gives us an idea that this disease condition runs a chronic coverage, because once you are schizophrenic, there is very less chances that you will return to the premorbid functioning. Okay, so defining schizophrenia, if we define schizophrenia, it is defined as, or it is rather characterized by disturbance in thought process, perception, and effect. So what I have written is, it is characterized by disturbance in thought process, perception, and effect, invariably resulting in deterioration of social and occupational functioning. What does it mean? It is characterized by disturbance in thought process. So a schizophrenic person, whenever he is in a particular situation, or whenever he is exposed to particular stimulus, the thoughts regarding that situation or that stimulus is disturbed. The disturbed thoughts come, like there is incoherence of the thoughts, or there might be flight of the thoughts, or incoherence. More about incoherence, because flight of the thoughts is seen in mania. Incoherence of the thoughts means wherein he thinks about whatever he is thinking is totally irrelevant to the situation, or if he puts two thoughts together, they might not be relevant to the each other also. So next is perception. Perception is our understanding regarding anything. So schizophrenic perception regarding any event will be irrelevant, and also there is disturbance in the effect. Effect is the emotional tune, the emotions which he will be expressing in a particular event, which will not be relating to the event itself, and which invariably results in deterioration of the social and occupational functioning. I think I have explained this earlier. So if we try to put this in an example, like we have seen in our society, there are those men which we in layman's language call madmen या पागल लोग जो होते हैं हमारी सोसाइटी में, those people who just don't care about their dressing, who just don't care about their hygiene, who just roam around and keep on laughing, giggling to themselves, muttering to themselves. We have seen in those persons, if that person is exposed to a situation, for example, somebody has died, some of his relative have died, and if that person when he comes to that situation, you will see him suddenly, he might be laughing, he will be crying, he will be doing odd gestures also, he will be doing those things which are not governed by the situation. He will be doing the things which the situation does not accept, or which the situation does not demand. So if we go once, so this is regarding the definition of schizophrenia, and now we'll understand more about as the schizophrenia evolves. We'll understand more about what schizophrenia is, and who basically are the people who we call as schizophrenics. So now after the definition, we shall see the incidence and the prevalence of schizophrenia in society throughout the world as well as in India. Schizophrenia has been seen. There is uniform prevalence throughout the world, or in India. Throughout India, we see the general population incidences. Several studies have determined that incidence in general population is 1%. That means 1% of the population is at risk for developing schizophrenia. But since all mental disorders, they have a Mendelian base or genetic base, so when there is already when there is a biological relative who is suffering from schizophrenia, this incidence changes drastically. For example, if we talk about this, one parent is affected. If one parent is affected, this 1% goes to 5 to 6%. If one parent is affected, their children have 5 to 6% incidence or chance of developing schizophrenia. When we talk about monozygotic twins or dizygotic twins, more about monozygotic twins. Monozygotic twins, dizygotic twins. They show a 50% higher rate than that of general population. So monozygotic twins are 50 to 60% higher rate than that of the general population. That means there is a 50% chance of developing schizophrenia. If one twin is suffering from schizophrenia, other twin will be having 50% chances of developing the same disorder. So this is about the incidence of the schizophrenia. And also more about in the incidence, we see WHO sponsored a study in ranking the diseases which cause disability, which cause disability among the individuals. Schizophrenia ranks among top 10 causes of disability in age group of 15 to 44. In age group of 15 44, schizophrenia is among the 10 leading diseases causing disability. How will it cause disability? As I earlier said, that it causes deterioration in the social and occupational functioning. Once a person is not able to perform his social role or occupational role, that means he is disabled. And also disability might be caused or might be induced by suicide. So one third of the patients with schizophrenia commit suicide. That is 1/3 of schizophrenics. So one third of the patients with schizophrenia commit suicide, and 1 in 10 those who commit suicide, 1 in 10 die of the suicide. And also talking about suicide ideation, 40 to 50% of the people have suicide ideation with schizophrenia, and 40 to 60% of the people have suicide ideation, and 20 to 50% of them commit suicide, have the attempts of the suicide. Okay? Other than that, onset of the schizophrenia, when does the onset come? Schizophrenia usually has the onset of schizophrenia is usually in the early adulthood or mid adulthood or late adulthood also. Usually if the schizophrenia occurs before the age of the 14, then it is characterized as very early onset schizophrenia, or if that is before 14, or if it is before 17, that is early onset schizophrenia. It is very early onset schizophrenia, and EOS is early onset schizophrenia. Usually it can occur in the adulthood, middle adulthood or late adulthood. That is after the age of 15 till 35 it can occur at any time. So earlier the onset, better the prognosis. Later the onset, slow the prognosis. Coming to the predisposing factors. So all the psychiatric illness are a result of multi-factors. Like there might be problems in the biology of a patient, there might be problems with the psychosocial behavior of the patient, or psychosocial problems, there might be environmental problems, there might be genetic problems as well. So all the psychiatric conditions are a result of combination of these factors, and schizophrenia is no different in that. So first we will study about genetic factors. Like I already told you, general population has a risk of 1%. When we see in case of where one parent is suffering from the schizophrenia, his children have 5 to 6% chance of developing the schizophrenia. That means there is a genetic base. Or simply if we say about monozygotic twins, when one monozygotic twin is suffering from schizophrenia, the risk for others increases by 50 to 60 folds than that of the general population, which determines to us that there is a genetic base. But although it has not been completely understood how the genetics plays a role, but there is a genetic base for the psychiatric development of the schizophrenia. Okay, next one in this is biochemical factors. In biochemical factors, we have dopamine hypothesis. How does this dopamine hypothesis is generated? Schizophrenia is believed to be due to the excess of dopamine dependent activity in brain. So what happens in schizophrenia is there is excess of dopamine activity inside our brain. So the proof for this exists in amphetamines. Example of amphetamines is methamphetamine or ecstasy. What amphetamines are? These are CNS stimulants, which a person takes or sometimes also abuses. Why? Because he wants to enhance his cognitive function, or he wants to have a better perception of the environment, or simply he wants his CNS to function in an overdrive mode. So what these amphetamines do, when they increase the level of dopamine, by then producing the inducing the psychotic symptoms or psychotomimetic symptoms in the patient. That means when a patient has taken amphetamines, there will be production of, or there will be evidence of the psychotic symptoms in the patient. Okay, so to counter these psychotic symptoms, or to counter these psychotic symptoms, what we do is we give antipsychotics to the patient. Antipsychotics, either novel ones like risperidone, olanzapine, okay, and so on. And then we have others like typical ones. We have chloropromazine, haloperidol. These antipsychotics, once we administer these antipsychotics in the patients, what they do is they reduce the psychotic symptoms caused by the amphetamines. That is where the proof lies for the dopamine hypothesis. I'll go once more. The hypothesis is that we give amphetamines which increase the dopamine dependent activity inside the CNS, and then in order to reduce those effects caused by the increased dopamine activity, we give antipsychotics which reduce the symptoms caused by the antipsychotics. Next, we will go to some of the other factors, like we have other biochemicals which result in the schizophrenia, or which are significant in development of the schizophrenia. Those other neurotransmitters or other biochemicals are, there is dysregulation of norepinephrine, serotonin, and gamma aminobutyric acid, and acetylcholine, and acetylcholine. These neurotransmitters have also been seen. In the dysregulation of these neurotransmitters has also been seen in schizophrenia. Other than biochemical factors, we also have the physiological factors. Physiological factors, first one is viral infection. That is maternal exposure to influenza. If a child in his womb, in mother's womb, if the mother during her maternity gets exposed to the influenza, the children has a higher risk of developing schizophrenia than that of the general population. This was said by Sadok and Sadok. Next is anatomical variations. Anatomical changes simply when the CT or MRI was performed in the patients with schizophrenia, it was seen that ventricular enlargement and also enlargement of the sulci, ventricular enlargement and enlargement of sulci was seen associated with the schizophrenia. Ventricular enlargement in particular has been associated with poor premorbid personality, It has also been associated with the development of negative symptoms that we will come to know later what negative symptoms are and what positive symptoms are, and also it has been seen associated with cognitive impairment. So those clients who have ventricular enlargement, they have poor premorbid personality, they have more susceptibility for development of the negative symptoms, and they also have cognitive impairment. So it is association with the schizophrenia. Next, enlargement of the sulci is not so much significant in development of the schizophrenia, although there has been a significant correlation with sulci enlargement and schizophrenia. And also in the histological changes, we have seen the pyramidal cells in the cerebrum are in disarray. Pyramidal cell disarray is present in patients with the schizophrenia. So next, moving on from histological changes, we will now move to the physical conditions which have association with the schizophrenia. Talking about physical condition, there is a strong correlation between epilepsy and schizophrenia, especially temporal lobe epilepsy has strong correlation with schizophrenia. Also we see birth trauma and schizophrenia. Then we have Huntington's has association with schizophrenia, Parkinson's has association with schizophrenia. Then we also have alcoholism, alcohol abuse has association with schizophrenia. So these are some of the disorders, physical conditions which have their association or correlation with the schizophrenia. More important ones include epilepsy, especially temporal epilepsy, birth trauma, Huntington's disease and Parkinson's disease, and also we have alcohol abuse. They are associated with the development of the schizophrenia. And then these were some of the medical conditions, these were some of the biological or physiological conditions. Now we will see about the psychosocial factors which contribute for the development of the schizophrenia. One thing we must remember, over the past few years, with the advancement of the more advancement in the medical science, the social roles or the social theories in the development of the mental illnesses have lost their credibility, although it has been seen that they play a significant factor in the development of the personality of an individual. If your premorbid personality is strong, that means if your defense mechanisms are strong, and they can only be strong when there is a strong relationship, when there is a strong parent-child relationship during the earlier developmental stages. It has been seen that the failure are when there is a poor parent-child relationship, or whether there is a chaotic family atmosphere, the prevalence of psychotic disorders among those children is much more than in the children with the strong family dynamics. So in here also psychosocial factors talks about, although it doesn't hold credibility, but they talk about in those patients in those clients who had poor parent-child relationship, as well as at the same time had a chaotic family atmosphere, the development of the schizophrenia is, or the prevalence of the schizophrenia is more among such children. Okay, so other than physiological factors, we have environmental factors also. Psychosocial factors, we have environmental factors. In environmental factors, so many psychologists have been trying to relate between poor or lower socio economic class and schizophrenia. So what these psychologists say, they say poor socio-economic schizophrenia is a disease of poor socio-economic class. That means a person who is poor is more likely to develop schizophrenia. They say that the poor persons have more burden, they have helpless, they have hope, they are hopeless in front of the change. So these factors contribute to the development of the schizophrenia. And alternative to this is downward drift hypothesis, downward drift theory. So an alternative to the environmental theory which says that schizophrenia is a disease of the lower socio-economical class, the downward drift theory says because of the schizophrenia, because of the development of the symptoms of the schizophrenia, it gets difficult for an individual to maintain his employment, to maintain his, to perform his social and occupational roles. Because of that, he faces many more difficulties and he drifts towards a lower socio-economical class. That is it. And next we will, in next lecture, we will see about development of the schizophrenia. Schizophrenia develops in the 4 stages. We'll see what those 4 stages are, and we'll also see what are the types of schizophrenia, and then we will see what are the positive symptoms, negative symptoms, Schneider's first rank symptoms, and we will also see what is the mental status examination for the schizophrenia. Thank you very much.